The Cabarrus County Racial and Ethnic Approaches to Community Health Grant, funded by the Centers for Disease Control and Prevention, aims to reduce health disparities by increasing access to healthy food, physical activity opportunities, and clinical community linkages for the African American and Hispanic population.
A garden is successful if, in fact, the school uses it. The most exciting day in the planning process of developing a garden is the build day. There's a lot of anticipation, everybody ready to get, use the tools, get their drills out, do all the things that make it happen. But the reality is, after that build day is where the success really comes, and that's when teachers use the garden.
Some of the most beneficial outcomes truly has just how we've reached our children. Coming from a Title I district, a lot of our students don't have the food at home that they need and the nutrition that they need. And I was reached out about the Reach Garden Grant and signing up for it. I was just so excited because now my students would have the opportunity to learn how to grow their own food, learn why it's so good for their bodies, and actually find out that kohlrabi doesn't taste bad. It's been a great opportunity to give them skills in the future that they can have to make the right choices to help benefit their own families when they get older. And I just can't wait to see it grow and continue.
We have renovated or jump-started several community gardens, and some of them we created brand new off the ground, some of them they had the ideas, we just come in wherever they were at, we moved them forward a little bit. One thing they're doing is providing food for people, and we're talking hundreds of thousands of servings per year, actually, from all the community gardens we've got together. This one right here produced around 13,000 pounds last year. We're really helping the Mount Pleasant Food Bank. The Cooperative Christian Ministry is really benefiting from several of the community gardens. Also, one of the feeding programs in Kannapolis is impacted with one of the community gardens.
So the first part of the initiative that we participated in was the mobile food market. So we had a great success with having vegetables available every other week, every other Wednesday, and people came through the neighborhood, they expected it, they bought fresh produce, and that was great. And then the second one was we were able to expand our garden. We had gardens, we were able to expand to raised beds, we were able to get an irrigation system, we were able to get tools for the garden, and somebody donated a shed, I think I mentioned that before, and so we have a community tool shed for gardens. And then the third part of the initiative enabled us to partner with a group home that's right next door to the church, and they started a garden themselves, and they are continuing that garden until this day.
The REACH program has helped our food pantry enormously in dealing to emphasize healthier foods, and so traditionally food pantries have the reputation of not giving out the best stuff, especially for those who had high blood pressure or diabetes, and now we're able to emphasize our fruits and vegetables and our low sodium things and lower added sugars and whole grains and that sort of thing. And so customers are a lot more excited about the coming in here. They look so much better than it used to.
The REACH program has provided outlets for us, refrigeration for our produce, better display for our products, for our healthier products, and just a better overall function of our food pantry in order to better serve our clients and our community.
Decidimos participar en el programa porque creímos que iba a ser una buena idea para el negocio. Aprender tácticas de parte del Departamento de Salud, que es el que nos lo provee, y aprender a manejar un poco mejor el producto para el cliente, para el negocio, y nos pareció muy interesante ver cómo conocer un poco mejor el producto para ayudar al cliente a conocer cómo utilizarlo en sus comidas de una mejor manera, más saludable, tanto para el adulto como para el niño. La relación, claro que sí, ha sido muy emocionante el conocer personas que tienen una mejor noción, un mejor conocimiento de cómo manejar los productos, y compartirlo con nosotros ha sido muy emocionante, tanto para mí como para mi familia, en beneficio del negocio.
So with the Reach Farmers Market Initiative, I was able to work with our local farmers to provide access to EBT and SNAP transactions. So this was something that was not in before, and now we do have a way that anybody in the county can go to any local farmers market and use any type of payment in order to receive healthy foods. And then alternatively, with the Kannapolis Intimidators, we were able to create a healthy concessions policy, and that was probably one of my favorites. And now you do have an opportunity to go to a ballpark and actually receive healthy food options. This has been a wonderful approach to sustainability. I think this whole systems level approach is key to making sure that our partners have what they need in order to do this in the long term. So I think having them through the program was able to see the successes and see what it was going to take, and then guiding them through that and then turning them over on their own and just kind of being available for technical assistance has been tremendously grateful and a wonderful opportunity for folks.
This is a program that provides exercising classes to our community, our Latino community, which normally doesn't work out. And with having employees that are bilingual and that are Latinos themselves, they feel more comfortable to come out and exercise with us, and it has increased, the attendance has increased during these classes.
So I think one of the big successes that we had early on was the implementation of what we call the International Dance Festival. It's a multicultural event where we had both, Spanish-speaking instructors come and teach some dances from their parts of the world, and then we had some of our classes that we hold here taught by our regular English-speaking instructors, and just seeing them come together at this event with food and dance, and everybody was laughing, having a good time. I think that really broke the ice and made everybody feel comfortable and welcome.
It is a lot of fun because a lot of us love to dance, and as you know, Zumba is a Latin-inspired exercising program that involves a lot of dancing, a lot of cardio, and it's a lot of fun. It feels like it's a big old party. And I've had students that have said that they have lost weight and they feel more confident about themselves. The benefits are that we are exploring this with the Latino community, but you can see from when we started how it increased and how our community feels like they're welcome, not only by their Latinos employees, but also by the community themselves. They love it that we have this, and they bring their friends all the time.
I would say it's important because of children's health. Currently in North Carolina, a third of our students are obese, which puts them at risk for type 2 diabetes, heart disease, stroke, and this just sets the stage for a downhill slide in their health if we don't do something in elementary school. It also gives them physical activity that they don't get enough of now, which stimulates their brains, helps them focus better in class, and actually improves their test scores.
Safe Routes to School is one thing that came in. I believe it was my second year here, and I loved it because it really just was confirmation of us to check the systems that we have in place with transportation, getting kids to and from school. Our other initiatives that we are doing across Kannapolis City Schools is the open space policy, open use policy. Again, I really like this one, and I'm seeing it in action because after school hours we're seeing our playground and our facility being used. We just got a beautiful walking track thanks to you all, and that is another part of where the community can come in. Love that there's signage provided with it also. It shows the route to take, how many times around the track to equal a mile, and you actually have people from the community outside of school hours coming and using that, along with the basketball hoop, the playground.
Reach provided us with the funds to create the active transportation plan that encompassed our downtown area, and then also we were able to get Reach funds for the Loop the Loop walking route program around our downtown Kannapolis area. So the active transportation plan looked at different connections that would make our downtown area more walkable, and then the Loop program established 5 walking routes around the downtown area, and then we were able to add on to that and expand that to an additional 5 routes around 6 schools in the Kannapolis area. So we were able to really expand that program.
I think the most important factor is that families don't know what they don't know. And the more that we can educate them and give them access to resources, the better they can get help and get that access to those services as quickly as possible for their children. We know that 1 in 5 children are dealing with some type of brain disorder, and so having that access to the network of care has been invaluable for the families that we serve.
I feel like the network of care fair increased awareness of the residents of Cabarrus County in terms of what resources are available. I also hope that those who participated went away encouraged to consider their health and maybe make some changes for their overall well-being.
So many years ago, we began this partnership with the REACH program to start asking and recommending patients to be on a walking or exercise regimen. We would ask them, outside of your normal work, house care routine, how often do you exercise? And they would give us a approximate answer, and then we would ask them, well, how many days a week and for how many minutes? And based off of that, the provider, either the doctor or the nurse practitioner, would recommend that they be given exercise walking prescription.
Most of our patients not only have lost between 20 to 30 pounds, but they feel good about themselves by eating better, changing not only for a period of time, but for the rest of their lives.
I would like to thank the Centers for Disease Control and Prevention for providing the funding for our REACH program, which has accomplished amazing things in our community. I'd also like to thank our community partners for the work that they've done to make sure that REACH has been the success that it has been and improving the health of all of our community.